We know that smoking is affecting nearly all the organs of the body and is a major contributor to death and disability across our region. Murrumbidgee Local Health District is absolutely committed to the New South Wales State Health Plan, which targets reduction in smoking right across our populations. And we know that when people come into hospital, there's an important opportunity for our clinicians to engage in conversations with patients. If every clinician engages in this opportunity, together we can all make a difference in reducing smoking rates in our population. We know there are benefits directly related to patient care when we do that.
The policy of providing brief intervention in hospital brings my role to the forefront. We really need to address the high rates of smoking, the high rates of COPD, the high rates of lung cancer in our district, and by identifying those smokers perhaps early in the disease and referring them to the appropriate health professionals, we can really make a difference to our patients. If we think about the challenges to the staff, thinking about nicotine dependence is just an extra challenge for them. I think what we really need to do is make it a priority so that all staff realise the importance of helping people with their nicotine dependence.
What we've been able to do with our integrated care project is make sure that our staff are appropriately trained and they feel confident to be able to have the right conversation in the right setting, so the patients don't feel like they're under any pressure and we're not actually interfering with our relationships, but actually putting it in a positive frame and letting them know that we're here to help and we can coach them through this and work on it as a team.
So in my experience, if we take the opportunity while they're in hospital to start with the interventions, implement the nicotine replacement and provide that follow-up afterwards, we have more success.
Not everyone might know that it's also, the policy also states everyone deserves a brief intervention.
The patients are not always ready to quit smoking when we first offer it to them, but if they present again and we give them another opportunity, they may be ready the next time. So it's important that we offer them every time they present.
So in my experience, when a patient is hospitalised, particularly if they're hospitalised for a tobacco-related illness, they're very open to that education about smoking cessation. Most smokers do want to quit.
For our service and our frontline clinicians, there's nothing more exciting than a success story, and to be able to work with someone in the community to help them quit smoking is a pleasure and also a really rewarding experience.
If you're doing brief intervention and it is an everyday thing that you do in clinical practice, it empowers the smoker, and if they feel empowered they might give up smoking and therefore have less of a burden on the health system, but it also have a healthy lifestyle for themselves.
What will make this successful in Murrumbidgee Local Health District is making it sustainable. So actually having the procedures in place and the resources in place so that it's an ongoing commitment. We need all health professionals to be on board. We need the nurses, the doctors and the allied health and the pharmacists to all make it a priority for our patients.